Let's go to a Liberal member of the federal parliament now. Jason Falinski is the federal member for Mackellar, so he takes care of Sydney's northern beaches. Thanks for joining us, Jason. I think the northern beaches, but particularly a sensitive area when it comes to this lockdown of Greater Sydney, because of course you were all locked down over Christmas, while the rest of Sydney had a free and happy COVID-free Christmas. So you did the hard yards then, yet now, when you have no COVID in the northern beaches, you're having to be locked down with the whole of Sydney.
Mate, you're absolutely right, Chris. Problem is, every time you show photos of the northern beaches, everyone goes, what are you guys complaining about being locked down there?
Yeah,
but, I mean, there is but I mean, there's a serious problem. I mean, we've got kids who aren't going to school. We've got people who aren't going to work. We have families that are being separated, good businesses going bad. And when there isn't a health reason for doing it, it becomes pretty hard to keep justifying.
Now, I think that, look, we all understand you don't want people who are working in the northern suburbs commuting in and out of Sydney. Now, you could have something in place to stop that, as we were just discussing with Shell Harbour, but why can't kids go to school there?
Chris, I don't have an answer to that question. And by the way, it's not just the northern beaches. I mean, Pimble's got 0 cases. North Sydney's got 0 cases. Mossman's got 0 cases. I mean, the list just goes on and on and on of places around Sydney where you just, I mean, if you wanted to get infected, you couldn't.
Yeah, you're so right. And look, nobody has pursued this very rational argument better and longer than Paul Murray on this channel. Every night at 9 o'clock, see Paul Murray live. But he's gone through the council areas in this state and elsewhere where there's 0 cases, yet people are suffering unnecessarily, needlessly, particularly kids not going to school. But I want to go to the broader issue now, Jason, given that obviously you're in the federal politics rather than state politics, but there seems to be a consistent view about this lockdown across both the state and federal government. Yet why are we going so hard, even calling in the army now, to lock down a significant outbreak in the western suburbs of Sydney, even though all of the vulnerable, the most vulnerable, have had their chance of vaccination? Everyone in aged care is vaccinated. Everyone over 70 should be vaccinated, and that's ongoing. But also, this lockdown takes us till September, and on the Prime Minister's own reasoning, we're supposed to be opening up and living with the virus within a couple of months of that.
I mean, Chris, that's a really good question. I think in terms of the ADF being deployed into these areas like they were in Victoria is because we don't have a health order problem, we've got a compliance problem. And the best example of that is the wake at Pendle Hill, where we know at least 50 people attended. Of those 50 people, 45 have now tested positive and 2 people have tragically died from it. But your point is absolutely on song, which is the whole point of vaccinisation is to help us live with the virus, not to end the virus. So the example of the UK could not be a better one, where they've got 75 to 80% of people fully vaccinated, but they are getting, at one stage last week, over 50,000 people a day testing positive. And we might end up, we'll never get to those numbers. But the point of people being fully vaccinated is that it allows you to have those positive numbers and to stay open. And that's the point of the vaccination.
Yeah, look, and we all know the more people vaccinated, the better. So, you could lock down forever until we get... But it's about judging what's reasonable. Now, of course, I disagree with some aspects of Victoria's lockdown last year, but they had no option but to lock down and try and contain that outbreak. There was no vaccine. The elderly were being decimated. We have a totally different situation now.
We absolutely have a totally different situation, which should allow us to to keep these lockdowns as localised as possible, targeted as possible, and for as short as possible because of your point. I mean, we haven't had a single death in aged care. I mean, in the Victorian example that you were just speaking of there were over 800 deaths in aged care. We're not seeing anything like that on this time. And all I'm saying is that I think all of us should be reasonable and driven by the science and data. I mean, we hear that in so many other areas of public discourse. Why not in this particular case as well?
Absolutely. I'd like to see more data about the people who are seriously ill in hospital, how many are vaccinated and how many are not. But so far, the data suggests most of them are unvaccinated. 2 more deaths today. People are in their 80s and 90s unvaccinated. That shouldn't be the case. Now, these will be people who have chosen not to for some reason, and it's a bit of a warning to everyone. If you have, an elderly person living at your home, a grandparent you know who somehow has fallen through the cracks or has been resistant to getting a vaccine, get a vaccine because you can pick it up so easily.
Yeah, there are 2 points that I'd like to make on that, and I think your point's a very key one, which is people should get vaccinated. However, it's their choice. They're adults. They can make that decision. And our key metric here should not be how many people are vaccinated, but whether everyone's had a chance to be vaccinated. Otherwise, our community, our nation, will be held hostage to circumstances as to whether people see it's in their personal interest or not to get vaccinated. The key to this is whether everyone's had an opportunity to be vaccinated. So the Grattan Institute came out this afternoon and said, not until we get to 80%. I think that is just really holding us ransom to a number that we shouldn't allow ourselves to be held to.
Yeah, I agree wholeheartedly. And I would add, though, that in this country, everybody over 70 has had an opportunity. There's no excuses for anybody over 70 not to be vaccinated.
That's right. That's absolutely right.
Thanks for joining us, Jason. I appreciate it.
Thanks for your time, Chris. Really appreciate it.
Jason Falinski there on those horrid northern beaches of Sydney. Yes, as he says, it's not a bad place to be locked down, but you want kids at school and shops and businesses open as much as you can. You just have to stop that interaction with Greater Sydney where there are cases. There's no cases up there now.